The treatment for preeclampsia is delivery, right? So you get the baby and the placenta out so that the preeclampsia doesn't get worse, because again, remember, preeclampsia is a disease that's pregnancy specific. So if you deliver and the baby and the placenta are out, why is it that you can get postpartum preeclampsia when it's no longer in your system? That's the thing. The baby and the placenta are out of your system, but you still have the pregnancy hormones and all of the changes that happen with pregnancy. It is still running around in your body. It's not like you deliver and your body goes back to normal like the second everything is out. Now, yes, the treatment is to get everything delivered so your disease process doesn't get worse, but you can still have preeclampsia postpartum. And yes, this can even occur if you had a normal pregnancy, no complications, you never had an issue with blood pressure, you never had swelling, and you can still develop postpartum preeclampsia, because think of it that all of these hormones and all of these changes are still running through and coursing through your body. And you can get postpartum preeclampsia up to 6 weeks postpartum. We typically see it if it's going to happen within the first 2 weeks after delivery, but you can still see postpartum preeclampsia at the 6-week mark. Now, if you had no symptoms of preeclampsia or anything like that, and then you all of a sudden find yourself readmitted a week after you had your baby with postpartum preeclampsia, or you're unsure what the symptoms are, they're very similar to the symptoms that you would have in pregnancy. So again, visual changes, so changes to your vision, floaters, stars in your vision, a headache that does not go away. You can get pain up in your right upper quadrant where your liver is, because it can cause liver inflammation. Sometimes it's epigastric, so more midline pain that can be seen as well. You can still get the swelling. Sometimes you can even have difficulty breathing and shortness of breath. That's because your lungs can start to be leaky and fill up with water and fluid. So yeah, postpartum preeclampsia is definitely a thing, and there are certain risk factors, like say you do have high blood pressure in pregnancy, but you didn't get preeclampsia in pregnancy, you can, right, that's like a risk factor for developing postpartum preeclampsia. And there's like a slew of other things that could cause postpartum preeclampsia, but yeah, it sucks. It's definitely not talked about enough. I have a longer video on this as well. You'll just probably have to scroll back, but it's labeled, where I explain it a little bit better. But yeah, I hope that made sense.